We are a few months further into the global pandemic, and COVID-19 is now surging in the southeast. So it's time to revisit some very practical issues related to staying safe during this summer season. Hello, I'm Dr. John Waits, a family physician that delivers babies, leads a residency training program, and together with Dr. Lacey Smith, I co-lead a network of community health centers in central Alabama. As we all now know, COVID-19 is the disease caused by the novel coronavirus. At the time of this video, there have been over 2.5 million confirmed cases and 125,000 deaths from COVID-19 in the United States. To put this into perspective, it is more than double the deaths caused by influenza this season. Astoundingly, to keep those huge numbers that low, most of the U.S. went into an unprecedented shelter-in-place lockdown, which has significantly affected the economy. There have been 36 million unemployment claims over the last 2 months, representing an unemployment rate between 14 to 20%, just shy of the 25% unemployment rate during the Great Depression. Clearly, people are hurting and frustrated. In discussing COVID-19 with our employees and our patients at Cahaba, as well as business people and stakeholders who have reached out to us, the most frustrating thing has been not knowing who to trust for reliable information about the coronavirus, the perceived overreaction of the lockdown, as well as the utter exasperation of having sacrificed so much in the spring, but the pandemic somehow isn't over. This video isn't a comprehensive review of all of these topics. Instead, I'm hoping to address a few very practical things that I hope make an immediate difference in your life and in our communities. First and foremost, let me acknowledge that there are a lot of different ideas of where this virus might have come from and how exaggerated or unreliable the data might be. So let's focus on what we know now. We have a virus with us now. It isn't nearly as bad as it could be. Imagine, for example, that Ebola went airborne. That being said, it's clearly causing illness and death beyond just the nursing homes and prisons. We've had several employees lose family members to COVID-19. However, we've also had neighbors lose their jobs, and we've shared the heartache with friends and families who have had to shutter their small business, none of them knowing when this might relent. No one wants to go back into lockdown again after so much sacrifice. What we know this July that we did not know in March is that we've now seen numerous examples of countries who did not shut down and weathered the pandemic well. It is well known that the U.S. leads the world in total deaths from COVID-19. The overall number is difficult to compare to smaller countries. There is so much controversy right now. Let me attempt to use the least controversial data: deaths per capita. The U.S. is currently number 9 in the world, with 38 deaths per 100,000 in the population. On the other hand, South Korea had less than 1 death per 100,000 in their population. There are a lot of studies being done to suss out what the differences were, but 3 key things keep emerging. They tested early and often. They kept track of everyone who got sick and notified those they came in contact with. This is called contact tracing. There was widespread use of masks, a lesson that transformed their culture during the last coronavirus pandemic, the SARS outbreak of 2003. It's worth saying a few words about masks. What we know now from scientific evidence that we weren't quite sure of in March is that masks in public work to reduce transmission of the coronavirus. In the early months of the crisis, the CDC gave us advice recommending against the widespread use of masks in public. Much of this regrettable advice was because medical-grade masks were in severely short supply, and physicians in New York City were working without masks. There was also legitimate science that cloth masks do not filter out all virus-sized particles, or concerns that widespread public mask use might cause society at large to be overconfident and thus not do other equally important things like hand washing. Let me unpack both of those things. Cloth masks are not filtration masks, it is true. Without getting into too much detail, filtration masks come in many varieties, including the N95 mask that was in such short supply this past spring. Filtration masks get precisely fitted and are designed to filter out small airborne particles. The reason that N95 masks are not routinely recommended in public, but they are recommended for physicians or nurses in a hospital, is that the coronavirus is by and large not an airborne particle. When a doctor or a nurse performing a procedure in the hospital or clinic, especially near the mouth, even something as simple as administering a breathing treatment to an asthma patient with a nebulizer, then it is important for the healthcare provider to have donned proper PPE, including a respirator, which will filter out viral particles that are flying around in a closed space. On the other hand, when we're venturing out to a grocery store, it's unlikely you're going to perform a medical intervention on someone. But they might sneeze in your direction or merely get close to you while speaking, with the consequent spittle that accompanies some close conversation. This is where the cloth masks come into play. But is there evidence? Yes, there is. Multiple creative studies have shown that placing almost any type of fabric over your nose and mouth reduces transmission of high-speed droplets from your sneeze or just normal human speech to near zero. The journal Emerging Infectious Disease published a report in 2013 about a flight from New York to China in 2009 where some passengers boarded the flight with swine flu, or the H1N1 influenza, and many fellow passengers got infected. Some researchers looked at whether passengers who wore masks throughout the flight stayed healthier. The answer was yes. They were able to track down 9 people who got sick on the flight and 32 who didn't. None of the passengers who got sick wore masks, compared to 47% of the passengers who stayed healthy. Another way to look at this is that none of the mask wearers got sick, but 35% of the non-mask wearers did. This is a significant difference, and it's obviously relevant to the current situation. At the population level, a study recently published in Health Affairs compared the COVID-19 growth rate before and after mask mandates in 15 states. It found that widespread mask use led to a slowdown in daily COVID-19 growth rate, and that this rate became more pronounced over time. Or consider another study that looked at coronavirus deaths across 198 countries, and they found that those countries with higher mask wearing had lower death rates. But can't you use a mask improperly? Sure. Can't it make you overconfident? Yes, of course. But these are different questions that don't quite get at the larger issues of overall effectiveness, like the studies I've just mentioned. Another concern I've heard over and over is about the cultural implications of wearing a mask. That a mask represents being afraid or overtaken by fear. But let me ask you, when you carry your handgun, are you being ruled by fear or just being prepared to defend yourself or protect your family? We are simply following the science. Wearing a mask doesn't represent fear any more than washing your hands represents fear. It's simply the germ theory of disease. Can you take hand washing and mask wearing too far? Sure. But wearing a barrier over your nose and mouth during a pandemic seems like a reasonable step that's in line with the evidence. Another concern was about the cultural implications of wearing masks, that Americans don't wear masks like those in other countries do. But our response could be that it's possible to change our cultural behaviors based on scientific evidence and knowledge. I'm also wondering if anybody's ever seen a cowboy movie. At Cahaba Medical Care, we've tried to make the best of things and have a little fun while staying safe. When we're performing medical procedures, we use N95 masks and other proper PPE. When we're otherwise interacting at work, we've been wearing cloth masks, including bandanas. I've seen others find masks that match their outfit for the day. It's okay for us to change our behaviors and adapt to the evidence. The reality is that cases are increasing in Alabama and across the Southeast. At the time of this video, cases in Alabama have more than tripled since the lockdown days of April, resulting in 37,000 more cases that we know about and 950 deaths. Most concerning to me and your team of healthcare providers here at Cahaba is that Alabama is so remote from New York. The pandemic was barely here for us during April, but it is here now. The good news is that we're better prepared. We know more about this disease in July than we did in March. Testing is more available. Supplies are not nearly as critically low. The bad news, really, the risk, is primarily that we all get corona fatigue. Regardless of your political affiliation or your thoughts about where the coronavirus might have come from originally, the facts are that we have the virus here now, and the manner in which we as a society respond to it will directly affect what our summer looks like. It will directly affect how we experience this fall. It's going to directly affect what our 2021 looks like. And our ability to work together, united, will define whether or not we can keep our economy going, keep going to our jobs, keep our kids in school, and so many other things that we are realizing we shouldn't take for granted. I get it. There's a lot of feedback to give our leaders on both sides of the aisle about the way the winter and spring have gone. But your community health center, your physicians and nurses here at Cahaba Medical Care would like to ask you, our patients, our communities, please don't use the absence of a mask as your sign of protest. Not during a pandemic. We want you to stay safe. You personally. We want our communities to stay safe, especially the most vulnerable. Masks are battle tested to do this during a respiratory pandemic. We also want our communities to thrive, for restaurants and schools and churches and gyms and theaters to reopen or stay open. Masks are an essential part of the way that we, the people, can prevent the spread of this disease. Because if the disease spreads, we stand at risk of not just getting sick, but shutting down again. We can do this. I mentioned that masks are a part of the plan. What else? The 4 W's. Wear your mask, wash your hands, and don't touch your face or eyes. Wave, namaste, or elbow bump instead of handshake, and watch your distance. So, hand washing. Hand washing with soap and water is essential. You need to make sure that you use enough soap for the front and back of your hands, washing for 20 seconds, covering all surfaces of your hands, and then pay careful attention to what you touch next, such as the faucet or the bathroom doorknob. If soap and water are not available, make sure that your instant hand sanitizer contains at least 60 to 70% alcohol, covers all surfaces of your hands, and in this case is allowed to air dry. Hands touch a variety of surfaces throughout the day, which can be contaminated with the virus. The exact time that the SARS-CoV-2 coronavirus that causes COVID-19 can live on surfaces is not totally known, but we estimate up to 3 days on some surfaces. Frequent cleaning with appropriate CDC recommended cleaners such as Sani wipes, alcohol-based cleaners, and appropriately stored hydrogen peroxide or vigorous soap and water is essential. This is why you should avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When you cough or sneeze, don't cover your mouth with your hands. Instead, cover with the bend in your elbow or a disposable tissue, which you dispose of immediately into a closed trash can, then wash your hands. According to the WHO and the CDC, the coronavirus is spread from person to person through respiratory droplets. This means when a person coughs or sneezes, these droplets can land in the eyes, nose, or mouth to a person in close proximity. These droplets are too heavy to travel far in the air. They travel only about 1 meter, just over 3 feet, and fall to the ground and settle in the nearest surface. This is why we have a 6-foot distance rule, and again, masks can eliminate this spread by nearly 100%. Handshakes are another beloved cultural, social connection that we should consider adjusting during this pandemic, unless we can immediately wash our hands afterwards. Some options that we've been using at Cahaba have been the Red Cross elbow bump, hashtag VP Mike Pence, the Namaste, known in Alabama as the Tua, or the wave, popularized by Forrest Gump. At Cahaba Medical Care, we're here for this emergent issue, just as we're here for the long haul.